Hello and welcome to the session, The Newborn Baby. Today we will talk about the following subjects: preserving your baby's health, safety measures, and going out with your baby. A health follow-up with your physician or a nurse is essential to discuss your child's health condition and development. These follow-up visits are also great moments to ask questions or to share your concerns. Parents must take care of their baby's health and safety. Design an environment that is safe for your baby and that is easily adaptable to the baby's development. It is essential that you have a car seat to transport your child in a car as soon as they are born. Babies are particularly susceptible to microbes that lead to infections because their immune system is not very well developed yet. How can you protect them? By washing your hands frequently, by cleaning the toys they put in their mouth, by limiting your contact with sick or contagious people, by vaccinating them. Vaccination is recognized as the most effective public health measure. What are vaccines? Vaccines stimulate the immune system. They help children develop antibodies against certain diseases without experiencing the negative effects of these diseases themselves. Who are they for? It is recommended that all children be vaccinated, following the Quebec immunization schedule, i.e. starting at 2 months old. Contradictions are rare and they are always considered when vaccinated. Why give several vaccines during the same visit? The immune system can easily handle the administration of many vaccines at once. Babies are already exposed to various types of microbes every day by breathing, eating, drinking, playing, etc. The recommended vaccines only call upon a very small part of the immune system capacity. Vaccination is not mandatory in Quebec. Why should you have your child vaccinated? To protect them and prevent risks and complications related to disease, meningitis, pneumonia, death, etc. To protect vulnerable people around them. To protect the resurgence of some preventable diseases. Since the development of vaccines, certain infectious diseases have become much rarer. However, international experience shows that a reduction in vaccination rate leads to the resurgence of certain diseases and a rise in complications and associated deaths. Sudden infant death syndrome is the unexplainable sudden death of a seemingly healthy newborn under the age of 1. Still today, we do not really understand what leads to sudden infant death syndrome. Certain risk factors are more frequently associated to this situation. Secondhand smoke, commercial infant formula, room temperature is too high, unsupervised baby lying on its belly, high-risk environment, lung disease and infections, animals, etc. High-risk behaviors, prone position, baby on its belly, unsafe surface, reclining chair, crib bumper, baby in the bed with more than 2 adults, etc. Injuries are an important cause of death and medical consultation in children. Some accessories for babies must be used carefully. Stationary activity center must always be used under supervision and for short durations, around 15 minutes. Do not place next to a table, bookcase, etc. The child may make objects fall. Changing table. Be careful when using the changing table. They are one of the most frequent scenes of accidents. Never leave the baby alone on the table. Security barrier. The security barrier must be secured using a permanent fixation and not a suction cup. Avoid accordion or diamond-shaped barriers because they are at higher risk of strangulation. Small vibrating seat and swing. Use with moderation and do not let the baby sleep in these devices. Laying the baby on its back on a firm mattress is good for the spine. Stop using when the baby exceeds the recommended weight or age. Baby bouncer must always be used under supervision and for short durations, around 15 minutes, because it could put pressure on femoral arteries. The baby bouncer may increase regurgitation and may cause bow legs. Bumbo or bébé pod type seats. This type of seat is not recommended. The baby's posture in these seats is not the best for its lower back, pelvis, and legs. They place the child's pelvis in a posterior tilt position, rounded lower back. This is not what we want to see in a seated child. Pelvis perpendicular to the ground. Furthermore, the position of the legs does not respect the physiological position of the hips that should be favored during the first few months of life. Flexion and external rotation. If you have one, use it on the ground only, for short durations, under 5 minutes, and not repeatedly, under supervision at all times. Front and back baby carriers. Do not use outside when it's cold because the pressure it puts on the femoral arteries can reduce blood flow to the legs, which may lead to frostbite. Take the time to read Keeping the Baby Safe from the From Tiny Tot to Toddler Guide. It contains advice on keeping babies safe at all time, wherever you are. Baby proofing tips. A healthy baby can go outside every day, even in winter, as long as the temperature is minus 12 degrees Celsius or higher, or following your judgment, and it is not too windy. Duration of the first time outside, 20 to 30 minutes. Make sure that the baby is comfortable. Time outside is also good for the parents. The type of car seat you should use depends on your child's weight and height. Check the car seat manufacturer's recommendations for maximum weight and height to choose the proper seat for your child. Check the following criteria. It is not past its expiry date. It has the Transport Canada compliance label. It has not been in an accident. Babies should not be exposed to the sun without protection. PABA-free sunscreen, hat, and umbrella. Before 6 months old, it is best to keep your baby in the shade, as sunscreen could cause an allergic reaction. After 6 months, dress the baby in a hat and clothing that covers the arms and legs. Apply SPF 30 sunscreen to expose skin 15 minutes before going outside, even in cloudy weather. Never sit your child facing the sun. Low-quality sunglasses are worse for your child's eyes than no sunglasses at all. Most sunglasses bought in department stores have molded frames that may distort the view. This can lead to headaches and perception problems. Avoid exposure to the sun between 10 a.m. and 2 p.m. Baby oil does not protect from the sun. It increases the risks of sunburns. To protect children under 2 years old from insect bites, put mosquito net over the stroller. Dress your child in long clothes. Avoid going outside at sunrise or sundown. These are when mosquitoes are most active. Insect repellents must be used with caution. Citronella, lavender, or eucalyptus oil-based insect repellents are not recommended for children under 2 years old. Products that contain DEET are not recommended for children under 6 months old. Between 6 months and 2 years old, DEET and soybean oil-based products can be used if the risk of complications caused by insect bites is high. Choose 10% DEET or less. Do not apply on the face or hands. For any questions regarding the content of these prenatal capsules, you can contact your region's perinatality nurse.